So, really briefly, let's talk about protection motivation theory. Again, this is an intrapersonal theory, so meaning, about what's going on, KSAs that are going knowledge, skills, attitudes, beliefs, experience, skills. I think I said skills already, for a particular health issue or health behavior. So, protection motivation theory is a pretty simple one. The concept of protection motivation is that this idea of fear underlying behavior by triggering threatening thoughts, and that you want to protect yourself from this feared outcome. So, we talked briefly about sort of the use of fear in public health campaigns, and that you do really have to be quite careful with how it's used. One is you can't use fear in the long run, like you can't keep people at like the fever pitch of fear all the time. That has a lot of backlash and it's actually ineffective. But if you do sort of help people see a realistic threat, so, help them do a threat assessment that, yes, indeed, if they are in danger of something, the key is then what are you recommending that they can do about it? So if you are sort of arousing that idea of a threat, make sure it's, a true threat. Like don't try not to overstate things in public health, because that again has some backlash. But then always give people what are these things that people can do to take action. So, protection motivation theory has two constructs: this idea of a threat appraisal and a coping appraisal. So, threat appraisal, this has to do with perceiving how serious or severe a threat is. So, a threat to their health, for example. So, this should look pretty familiar because we were looking at the health belief model, right? And you're probably looking at this and you're like, well, that sounds a lot like the health belief model. And it kind of is. In a sense, it's an interestingly sort of trimmed down version of health belief model. So, how serious is whatever this disease and condition is, or a threat to someone? Then, combined with how vulnerable do you feel to it? So, what do you assess as the probability that that threat is going to happen? And if it's more, it's in, how serious is it? So, the more serious it is, the more likely that you think that you may suffer from that threat. Then you typically will be more apt to change your behavior. So that leads to more behavior change. Um, and that's the threat appraisal. You also have this other piece that's called the coping appraisal. And this is an assessment of what is the act that you are being asked to, or what is your response? What is the something that you are supposed to do? So a protective or a new behavior. How effective do you think it is? So that response efficacy. So efficacy meaning, how well do you think that's going to take care of this threat? So clearly, the more efficacious you perceive something to be, yes, I think this will work, the more likely you would be to do the behavior. Also, you think about your response self efficacy. Here we go again. We got self efficacy all over the place. So, how self efficacious do you feel about being able to do that response? So, perhaps, somebody is, maybe what would be, well, smoking's, for example, or vaping. So anybody who's got a nicotine addiction, they may feel like it's pretty severe. They may feel like vulnerable where they're like, yeah, I definitely have an addiction at this point. And, I am, I do feel vulnerable to some of the negative pieces of, having a nicotine addiction. So, heart disease, whatever. So then looking at what is your self efficacy for the ability to quit. So it could be high, like, I think I can do it. I've tried a couple times, and I almost got there. I think I can do it, all the way to I don't think I could do it, in which case your response self efficacy is pretty low. So it just so they may not be doing it. So that coping appraisal. So again, protection motivation theory looks a lot like health belief model. But it's a little bit trimmed down version where you're looking at the threat and looking at what skill, like what things are you being asked to do in the coping appraisal. And that kind of determines whether or not somebody does a recommended behavior or not. And that is the protection motivation theory.